And I wanted to bring in Dr. Michael Jelinek, who is a specialist with infectious diseases. And this is obviously his wheelhouse. And I wanted to bring him because I know enough to self-medicate for allergies and the common cold. This is obviously not even anywhere remotely near my wheelhouse or on the planet of where my wheelhouse is located. So we appreciate Dr. Jelinek's time with us this afternoon. Doctor, thank you.
You're welcome.
So this, the first thing that I want to make clear to everyone, because there's so many different kinds of coronaviruses out there, and as I understand it, one of the reasons why we are starting at square one with this particularly is because it is mutated, and also we're unfamiliar with its behavior, with the period of contagiousness, and there's even been discussion on how easily it is spread down to how long it would even last on surfaces. Is that some of the hurdle that doctors like yourself and researchers are facing when trying to figure out the best way to treat this and acquire and produce a vaccine?
Yes, that's very important because this virus is so new to the medical community that no one really has a handle on it yet. So getting effective treatment, prevention, and figuring out how well it spreads, we've been way behind because we didn't get proper information out of China until well after the epidemic there had started and subsequently became a pandemic. Mm-hmm. So when you listen to Senator Sass has been one who's been very much on top of this, and he's said that we haven't gotten proper information out of China, and we don't even know whether the information that we do get is accurate. And the same could be said for other countries, but not knowing the true epidemiology, it's hard to figure out how to address the community needs and how to effectively treat this. So there are lots and lots of small research groups that are looking into how this can be best addressed. They're trying many different antiviral medicines and adjuvant medicines to try and see how they can control this.
Right.
And the drugs that you mentioned, hydroxychloroquine or Plaquenil, is one of the lead ones, and azithromycin or Zithromax is another. But there are many others that scientists are looking at.
Well, that's good that they've achieved some success with this. They said the 20 cases that they treated showed a significant reduction of viral carriage using those two things, the hydroxychloroquine and then the azithromycin, because this is stuff that we already have on our shelves. Is that I would imagine as well with the vaccine, because I keep hearing that the vaccine could take anywhere from 12 months, 14 months. I think maybe perhaps worst case scenario, 18 months. Is something like this? Do you think that maybe would be helpful in the short term until a vaccine is fully available for the public? Is that what they're approaching and researching with us?
That seems to be the most succinct approach to this, which is try and treat affected patients and limit the spread, and then focus as they are focusing. They're already trying the vaccine in human volunteers to prevent the transmission of the disease. So progress is being made, and it's at a phenomenally rapid rate. This is incredible how much research is being done and how rapidly things are being tested to see if they will work. It's experimentation.
Yes, I read that they didn't. Normally, there's some sort of animal testing involved usually with these in creating these vaccines. And the one that they had administered the other day, I read that was the first person. That was the first living thing that was being tested with this. So it's incredibly brave, but I also think it really underscores the urgency.
Yes, absolutely.
Wow. One of the other things that had been looking at to explain how contagious this is as it compared to, because, obviously the flu can be very dangerous and we've had other epidemics before, but I wanted to ask you as to your opinion on the level of contagiousness with this. There was one study that I had cited yesterday, and this was just researchers. These were only 9 patients that they had looked at thus far. So I would imagine, I mean, it's a very small sample in the grand scheme of things. But they said with the 9 individuals, the ones who those who were they said that the viral shedding was something like 1,000 times more than what you would see shed from infected individuals that had SARS, and they think that that's probably that's really explaining the rapid spread of this virus. Is that, I mean, that seems, because we all heard SARS was one of the most contagious things ever. I've never heard anything like this. I'd like your thoughts on it.
Well, SARS, it was another coronavirus, and it did originate in China as well. Coincidence? Who knows?
Right.
But the amount of viral shedding that has been seen with this it's pretty impressive, and when you have that amount of viral shedding, it's always easier to infect other individuals around the index case, which is the first case that
right, the patient
sees.
0. Yeah. Wow.
So it appears to be a rapidly multiplying virus which has the ability to co-infect other individuals because of the volume of shedding that the virus has, meaning that the patients release virus, and even asymptomatic patients release quite a bit of virus.
Is this why they're, not to interrupt you, but is this why they're also still testing positive even after it seems as though their fevers are gone and they are no longer infectious, but they still test positive, not so much for being contagious, but just as still kind of having, I guess, a residual level of it?
They may have ineffective virus, and that's the current working theory, that someone who's already well and recovering from the viral infection, who is still testing positive, the theory is that those viral particles that they're still testing positive for are no longer effective at infecting other individuals. But the jury's out on that. No one knows, but that's one working theory.
We're speaking with Dr. Michael Jelinek, who is a specialist with infectious diseases in the great Republic of Texas. And Doctor, I wanted to, one last question that I wanted to ask you in terms of vaccines and treatments for this. As you had just previously mentioned, it is a remarkable speed at which the medical and scientific community is traveling right now in achieving something like this. How long realistically, in your expert opinion, and just from everything that you have dealt with in your career, what realistic expectation should people have in terms of when they can hear news about maybe even more widespread, safer testing of vaccinations, or when it would be publicly available? How long do you think that would take?
I can only speculate, and I would imagine it's going to be at least another month or two before we get very widespread testing in this country, which would give people reassurance. But
yeah,
because I believe that most individuals, about 80% of people who get infected with this, have little to no symptoms,
and they wouldn't even know.
15%, correct. And these are the people that spread it to others, and this is why it's so important to restrict things like spring break.
It's hard for everybody, for sure. Yeah.
ruin your party, right? So,
Exactly. You know, and one last quick thing, Dr. Jelinek, and again, we're so grateful for your time this afternoon. This made me think of something that I had heard being discussed from some others, and then I think even Dr. Fauci had addressed this, touched upon it, not really addressed it in depth, although I imagine that discussion is coming. Is it when if with everyone self-isolating and containing or flattening the curve, as the phrase is, and making sure that the infection doesn't spike and overwhelm our health system, wouldn't this be a problem still until the vaccines are available? Because even after the infection rate goes down, is there a real concern that if the self-isolation period is over and say, in 15 days everyone's able to go out, do we need to fear that because we don't have widely available vaccinations out there yet, that this could actually spike again and we might be looking at doing this again?
well, one thing that may be that scientists are relying upon is herd immunity, meaning that even some of those people who are isolated and self-isolated or restricted to family maybe don't have any symptoms, maybe they were infected, but they're going to produce antibodies, so they're no longer going to be able to spread this to others. So this is how epidemics die down. The herd becomes immune, and it's herd immunity is very important. This is why when we have these isolated outbreaks of measles, it's because people haven't been vaccinated, and it's that the people that are the non-vaccinated population are relying, so to speak, on the herd to protect them against these infectious agents. But I believe that once we get a certain level of herd immunity, this will all die down and it will go away, and it will be a very bad memory, but it will be going away like all epidemics and pandemics do. They all die out.
Good. That is good to know for sure. Dr. Michael Jelinek, infectious diseases, we are so grateful for your time with us this afternoon and just telling everybody and answering those burning questions that everybody's talking about as they are isolating at home. Doctor, thank you so much. And we appreciate you being on the front line of this as well. And we're praying for your health and safety. Thank you, Doctor.